Welcome to today's information session hosted by the Health Services PhD program. We are part of the University of Washington School of Public Health, Department of Health Systems and Population Health. My name is Lauren Sikowski. I use she, her pronouns, and I work with this program, talking to prospective students, and I also work with a few other programs in the department. And yeah, I'm looking forward to going over some of the highlights and details of this program and answering whatever questions you have. So a few logistics before we get started. We do record these webinars. So for everybody's privacy, no need to turn video on. Everyone can just relax with video off. And then if everyone can remain muted throughout the session, that would be great, just so everybody can hear clearly. And throughout the presentation, if questions come up, feel free to make use of the chat box. You can either send them privately to me or for everybody to see, whichever one you prefer. And then I might take them as they come in, or I might hold them for Q&A time, just depending on how we're doing time-wise. And then also, if using the chat feature isn't comfortable for you for whatever reason, feel free to temporarily unmute yourself and speak your questions out loud. And then last, don't worry too much about writing down every single detail. I will send out slides after this to everyone who RSVP'd, and there'll be plenty of live links in the slides to learn more about the relevant information if you want to dive more deeply into any of these topic areas. All right, so I'm going to go ahead and jump in. So the mission of our program is to train independent health services leaders and researchers, and to prepare them to provide leadership in the field. Our students gain analytical and practical knowledge and skills for conducting research aimed at improving the health of diverse communities. We teach our students approaches, methods, and principles for conducting research with practical applications for improving the public's health and the effectiveness of healthcare and population health services. We also teach our students to understand the means by which social inequities and racism generated by power and privilege undermine health. So now we're looking at some demographics of recent cohorts. An essential part of our identity at the UW is our commitment to equity, diversity, and inclusion, and that's reflected in our student body. They come from a wide variety of backgrounds, academically, personally, and professionally. So the PhD program deliberately keeps our incoming class size very small. So in a typical year, our class sizes are about 5 to 8 students. It's actually been 7 students at least the last 2 years. And yeah, we do that so we can give our students the most high-touch experience possible. So the most hands-on mentorship, the most access to funding support. And the majority of our students are attracted to our program from out of state. So about 3/4 of our students come from outside the state of Washington. And international students have comprised about 14% of our student body. The majority are domestic US citizens or permanent residents. We do welcome international applicants, but I think the reason that this percentage has been historically lower has to do with a couple reasons. First, this program's content is focused on training experts in domestic issues of population health and the healthcare system within the United States. We have very little comparative health systems or global health content. There is some in the beginning, but not much. And UW does have an excellent global health PhD program, but it's just a separate one from this one. It lives in the global health department. And then the other reason has to do with our funding. So our funding sources are limited to US citizens and permanent residents in this program. So international students that have come through are typically funded, they either bring their own funding or they're funded through assistantships. We'll talk about that a little bit later. And then we can also see that our program has been historically majority women, a little less than 3/4 self-identified as women on their applications. About a quarter were men, and about 4% didn't self-identify as either men or women, and those folks also shared non-binary pronouns. And of course, this does not matter. We do welcome applicants from all gender demographics, and this is just for transparency. And this is consistent with what I think we see in the field of public health. And then students of color have comprised about 50% of our student body in recent years. And then we can see a breakdown of Asian Americans at 18%, Black or African Americans at 9%, Hispanic, Latinx at 18%, Native American at 5%, and Hawaiian and Pacific Islanders at 0% in recent years, just in the last 3. And again, none of these factors are considered when we're making those admissions decisions, but we do definitely have folks asking because they want to know what their community will look like when they join us, and if it's an inclusive environment and stuff. So important to share. So the format of our program is full-time on campus. There's no online component of this degree. And the average time to graduation is 4.4 years. The vast majority of our students do complete the program within that 4 to 4.5 year range. So we do a good job of getting students in and providing them with rigorous, high quality training, and then getting them back out the door. We know people don't want to languish in their PhD program forever, so we do a good job at keeping that graduation turnaround pretty tight. And 100 credits are required to earn the doctoral degree at the University of Washington. And we're on a quarter system rather than a semester system. So these are fulfilled through 12 to 13 required courses. And you have 30 dissertation credits, as well as at least 5 courses in your area of emphasis. So all students will choose an area of emphasis to focus on during their time in the program. We have the health, behavioral, and social determinants of health, the evaluative sciences and statistics, health economics, implementation science, and occupational health areas of emphasis. So it's not required that you know for certain which one you plan to pursue when you apply. You actually don't officially declare an area of emphasis until you pass the preliminary exam in year 1, and then students would officially declare it in year 2. But at the time that you apply, it's appropriate to have some sense of maybe 1 or 2 areas that you feel the most drawn to pursue in the program, and state that explicitly in your written materials, in your statement of purpose. And we have a link at the bottom of this slide that, again, I'll send out later for you to dig into these. There's unfortunately not enough time to go into all of them here today, but definitely encourage you to read about these. And we also encourage folks to connect with the faculty leads of these areas of emphasis, and these are listed on each of the pages, which faculty member leads each area. Either get connected to them or click on their profile to learn about what type of research they're doing. That can kind of help you narrow down your interests and who you would want to work with in the program. And again, to state explicitly, we'll get into the applications in a bit, but state explicitly if there are faculty leads that you're most excited about working under. Okay, and this is the most overwhelming slide, I swear. Again, don't worry about writing this all down. You'll have access to this later. But this is an at-a-glance example of what 4 years in the program would look like. So I'll walk you through just some of the rhythms and highlights of the PhD program here. So I mentioned before that we're on a quarter system. So from left to right, we can see autumn, winter, spring. And then top to bottom, we have years 1, 2, 3, and 4. So the first feature that I want to highlight is our 3-course sequence, the HServe 512, 513, and 514 that we can see in year 1. So in many ways, this sequence is at the heart of our program. This provides the knowledge and content that we feel that all of our students need to have in order to become experts in the discipline of health services research. So you can see it covers everything from health systems and policy, health policy research, to the social determinants of health and health disparities. This is an excellent series, I think. That's the feedback that our students give us. The faculty who teach in this series are very passionate. They put a lot of love and energy into making it the best it can be. And another thing to note is in our program, we have sort of a two-track system for completing the coursework, and that's based on the student's prior experience in biostatistics and epidemiology. So what we're looking at here in this example is someone who does not have the foundational training in biostats and epi. So they'll fulfill that in year one of the program. So we're looking at the biostats 511, 512, and 513, and the epi 512 and 513 that we can see. So those are the foundational biostats and epi courses. So some of you may have already taken equivalent coursework, perhaps through your master's training, especially if you've earned a Master's of Public Health or MPH degree. And if that's the case and you feel well prepared, you might choose to consult with the program director to waive out of those courses and begin with the advanced method sequence in year one. That's the HSERV 523, 524, 525, and that we're looking at in year two. And I'd say about half of our students do start with that sequence in year one if they've already completed the foundational data sets. Like I said, it's up to that student in consultation with the program director based on their prior experience and their comfort level with those topics. And that's not something that you need to worry about at this point, at the point of application. That's a decision that's made after you've received an offer and decided to enroll. And that's, yeah, between you and the program director. But if you do start with the advanced method sequence, that puts you in a position to complete the program a little bit more swiftly than somebody who did not. All right, so there's also the seminar in year one. There you'll have a guest lecture, practice a literature review and critiques, get some acculturation in the field of health services. We have our health econ class and our required course in racism and public health. And then we can also see here in spring of year one that our students are sitting for the preliminary exam. This is an exam that we call the prelim for short. Other universities might call it the qualifying exam. But basically for us, all first year students in our program take this exam at this point in the program at the end of spring. And this tests your mastery of all of the foundational content that you've learned in year one. So passing this exam certifies that you've attained sufficient mastery in these areas and that you can move forward and go on and begin to complete your independent dissertation research. So I want to say a few words about the philosophy of our prelim. So I know that some programs will admit way more students up front than they feel will succeed in the program, and then they sort of use the prelim to fail out students. That is not our model. We have a very rigorous admissions process review up front, so we can make sure that the students that we admit, we're really confident in their ability to succeed and thrive, and we're really committed to working with them for success in the program. So it is technically possible to fail the prelim and fail out of the program, but it's happened extremely rarely in the program's history. It's not how we use it. So we do need to see that students pass the exam and attain the level of mastery, but we'll work with them to get there. So basically the way that the prelim works for us is there are 5 components and you need to pass all 5 to pass the exam and move forward. So there are 3 written essays, one for each of the core sequences, the 5, 12, 13, and 14 series. There's a quantitative method section that will have you exploring novel data set, performing a bunch of analyses to answer questions that will draw upon your training in biostats and epi. And then there's also a literature review and critique section of our exam. And yeah, in order to pass the exam, like I said, you need to pass all 5 sections. And of course, should any of you enter the program, I wish you success in passing all 5 sections with flying colors the first go around. But yeah, it's fairly common for students to need to revise sections in order to obtain that passing grade. And those revisions would typically happen in the summer after year 1. So sort of could be a journey for some folks to get there. And yeah, like I said, we work with you through the process in order to make sure that everybody's got these concepts really solidly and they're really prepared to go on and begin doing their dissertation research. And it is a tough exam. It involves a lot of preparation. So typically our first year students are involved in study groups together throughout the year to prep. And I think it's a useful process. It works for students in terms of learning a ton and integrating all the knowledge, but it also helps get the cohort together and, bring them together as a group, as classmates and friends, and, sort of a trial by fire, if you will. Yeah, so that's the prelim. And then in year 2, you'll formally declare your area of emphasis and begin taking those courses. Those are where we can see it says area of emphasis elective. And then we can see the other benchmarks are in bold here. We have the written general exam, the oral general exam, and the dissertation defense. So these are benchmarks related to the dissertation progress. So the timing of those, unlike the prelim exam, is not set in stone. And this is an approximation of a reasonable guess at when those kind of points might happen. And this is subject to the individual's progress on the dissertation, but just going through them, basically the written general test will test you on your dissertation proposal, as well as on the area of emphasis content that you've learned. The oral general is the defense of the solution proposal. You've already probably been doing some research. You may have some preliminary results to share at that point. And the defense in spring of year 4 is the defense of the dissertation itself, right before you graduate. And for us, what the dissertation project actually is it's 3 papers on novel research that you've conducted with your dissertation committee, and it's of publishable quality. So we do require that our students have submitted at least 2 to 3 dissertation papers for publication by the time that they graduate. We do not require that they've been accepted for publication because we know that even if you've done your best work and you've written a gorgeous paper, you and we can't control whether journals are ultimately going to make the decision to accept and publish. But we do want it to be of publishable quality and have been submitted. But I do think that this requirement's one of the things that contributes to our excellent track record of publication that we see among our students. And then we do have the expectation that students are involved in research in some capacity from their first quarter in the program, and that they're maintaining that research engagement throughout their time. So students are doing a lot of interesting work. They're publishing a lot. And you can actually see the publications for some of our students on the website. It's linked to PubMed, so it indexes there. So I encourage folks to check it out and see what folks have been doing. So looking at this just kind of big picture, we can see visually that a lot of the coursework is front loaded in years 1 and 2. So most of our students do aim to complete their required coursework by the end of year 2. It's not always possible to completely wrap it up by the end of year 2. Even in this sample schedule, you can see that some folks are doing a couple courses and wrapping up some of their seminar in the later years, but for the most part, students do aim to complete their coursework as much as possible by the end of year 2, so that they can really focus on the dissertation in years 3 and 4. And this is also going to give them a lot more flexibility in their schedule in the later years because they're not required to come to campus multiple times a week for courses. They might still choose to come to campus a lot. Many of our PhD students like to use the PhD student lounge, or maybe they have offices on campus, or prefer being close to our faculty and just like the environment, but there's a lot more flexibility in those later years once the coursework is complete. So research excellence is the pride of our program. UW is one of the nation's leading research institutions. We're an R1 institution and we're ranked #1 among public institutions in the nation in receipt of federal research funding. And what this means is there's a ton of research going on here, a lot of dollars coming in to support that work. And our faculty are using those funds to support and mentor graduate students. So our department, the Department of Health Systems and Population Health, is a leader in the field of health services research. We have many opportunities for multidisciplinary research going on, both on campus and with our numerous partner organizations and agencies. So we can see some of those listed here. There are too many to list them all, but these are some of the key players that we're looking at. We have the nationally known Fred Hutchinson Cancer Research Center. We work very closely with them, as well as the VA Puget Sound Healthcare System, the Kaiser Permanente Washington Healthcare Research Institute, another household name, the Seattle Children's Hospital. At UW, we have a fantastic Latino Center for Health, as well as we have the Foundation for Healthcare Quality, terrific local public health department for public health. We've seen Seattle King County, as well as the Tacoma Pierce County Health Department, Washington State Department of Health, as well as the Department of Labor and Industries and Social and Health Services, and the Washington State Healthcare Authority, in addition to numerous health plans, insurers, hospitals, clinics, etc. So at this point, I'm going to move into talking about faculty advising and mentorship. So to contrast our model with a model that I know exists at some programs or institutions, I know that there are programs where it's basically the responsibility of the applicant to secure commitment from a faculty member to work with them prior to even entering the program, but that is not our model. Here you do not need to secure commitment from a faculty member to work with you. So at UW, we will match all of our incoming students with their first-year faculty advisor. We do this based on the fit of research interests, student preferences. Again, I mentioned you should list faculty that you want to work with in your written materials and your statement of purpose. And then we also base it off of faculty preferences and availability. And we do this matching in the summer before you enter the program. So at that point, there's plenty of time to get connected and start to get to know your mentor over lunch or coffee or a Zoom session. And yeah, just start to develop that relationship. And the faculty mentor matches are not tied to funding. So what they're actually going to help you with, they're going to help you with course selection, networking with faculty researchers, developing research plans, and getting attached to research projects. And then they're also going to help you with career development more broadly. But yeah, at this point, at the point of researching the program and getting ready to apply, it's a great time to start looking into who our faculty are. And we have some tools listed here that, again, these will be clickable links in the slides that I send out later. The first one I mentioned before, the area of emphasis, there's a leader for each one. So that's where this link takes you to the areas of emphasis. And if you click on each one, you can see who the leaders are. And then we have a list of folks who are faculty specifically in this PhD program. Then it gets a little bit more broad. We have a list of faculty in the department. They might not teach in this program. They might teach in like the MPH program, but maybe their research feels relevant to your interests. And then we also have, this is the nicest search tool that we have right now. It's through the School of Public Health's website. It's the SPH Research Interest Search Tool. And in this one, I like this because you can literally type your research interests. You could type like tobacco studies, and then only faculty that are involved in tobacco studies will populate. And under their name, it will let you know their department, if they're part of our department or another one. You can't filter by department with it, but it, you know, you can, I think it's kind of nicer than looking at a list of faculty names on a website and then having to then scan and see what their research interests are. It's kind of a nice jumping off point. Yeah. And you do want to make sure that I'd say if you do reach out to faculty, make sure that you're clear that you're not asking for a commitment of them to be your faculty advisor, because if you do, they'll probably forward your email to me because they might think that you're, you know, that you're not sure of what our application process is here. So I would just be clear if you do reach out to anyone to let them know that you're interested in learning more about what research opportunities there are going to be, or your fit in their research centers or that kind of thing. And that, yeah, you're not looking to secure funding from them or a place in the program. And I would say in your application, when you do list faculty that you're interested in working with, list a few because you can't tell if they're they don't make commitments to work with prospective applicants. So it can be hard to know like who's available, who's going to retire, you know, in the coming year, who might move to Boston, you know. So I would say list a few, cast a broad net in those early conversations to give us more folks that you're interested in working with. Yeah. So that was the advising for year one. And then as your interests evolve, you'll choose a mentor with expertise in the dissertation topic of your choice, who will become your dissertation chair. And this might or might not be the same person as your first year faculty advisor. So the first year faculty advisor could become a chair. They could be just a member of the dissertation committee, or maybe they're not on your dissertation committee at all. If your interests have evolved or you found other faculty that you prefer to work with within that first year, it's not locked in place who will work with you on your dissertation. And dissertation chair will help you with a bunch of different things. They'll help you with developing a feasible dissertation topic and agenda, forming the dissertation committee, actually getting other members on board, curriculum counseling related to the dissertation, finding and securing appropriate funding for your dissertation, and they'll also review your individual development plan or IDP. And that's a personalized plan that our students put together to help them maintain, basically make sure that they're continuing to meet their personal goals and career development during the program. And then here in this slide, I have some examples of dissertations if you would like to check those out. So career outlook is very strong for our alumni, which is great, because that's sort of the ultimate outcome of success. So we were founded in the year 2000. We've graduated over 80 students from the program. So we have a strong alumni network. They're working as leaders in the field of health services research in a variety of settings, in academia and research and policymaking organizations, in the healthcare industry, in the private sector, and in government agencies on all levels, local, state, federal, and tribal. So in a recent survey, we did find that 100% of our alumni are employed in research, 98% in health services or related fields. And then among alumni who are working in faculty positions, 40% were in tenured positions. The pie graph on the right shows that about 60% of our alumni have some faculty capacity to their work, and about 40% are not as involved in academia at all. That could be in many different settings. They could be in the private sector or doing peer research. And then at any given time, chunk of applicants a chunk of alumni shown here, about 6% are completing a postdoc. And our alumni are, by and large, very well connected with the program. They're involved either directly by providing guest lectures or more informally by coming to our social events. And we see alumni at conferences. And on the bottom right corner of this slide, you can see a map of where folks are laid out, kind of all over the US. And one thing that's nice when students are getting close to graduation, and they're thinking about where they're going to live, they can reach out to us and say, hey, I'm thinking about moving to LA, who's there? And we're happy to make those connections. And yeah, it's a nice network to be a part of. Okay, so here we're looking at some sample career titles. I won't read out the entire titles with the where folks are working, but I just want to highlight the theme of leadership. It's satisfying for us to see our alumni going on and taking on these prestigious positions in their field. So we're looking at professor and chair, core investigator, director, a high-level epidemiologist, global wellness manager. So yeah, like I said before, it's the point of why we're here. So it's gratifying to see our alumni going on and having these successes. So now I'm sharing the approximate tuition and fees just for transparency. So our goal is to match students with financial support. So they're not taking on the full cost of the degree out of pocket. We don't want our students to be having to take out giant loans or having to pay for the PhD all on their own. We really want to match them with the support that they need, but we want to share the tuition amounts for reference. So UW is a public state institution. So we do have a two-tiered tuition rate for residents and non-residents. And most of the funding mechanisms that exist for doctoral students would automatically knock you into that lower tuition category. And then any tuition support would be applied to that rate. So what we're looking at here are tuition and fees, and then in bold, it's the combined tuition plus fees for 1 year. And then I just multiplied it by 4, but as we all know, tuition changes yearly. So that's why this is truly an approximation for what Washington residents and non-Washington residents would see for 4 years in the program. So taking a deeper dive into funding. So our goal is to match each student with sufficient financial support to meet their needs for their scholarship. And we'll work with each student to put together an aid or work package that meets their needs. So often what this looks like is a position on one of our no service grants for the first couple years, followed by the student working as an assistant or an assistantship, like a research assistantship or a teaching assistantship. That would often be in the later years in 3 or 4. And when I say no service training grant, what that actually means is, unlike an assistantship, it's called no service because you don't have to put in weekly hours in order to get the dollars. Basically, being a student, doing a good job in your coursework and everything, that's what your job is. And so that's what you're getting the funding for. And one of these training grants is through the Agency for Healthcare Research and Quality. That's the AHRQ NRSA T32 training grant. We also have a training grant that is affiliated specifically with our occupational health area of emphasis. And that comes through the ERC NIOSH, or NIOSH, some people say. And both of these training grants will have support for tuition and they'll have stipend. And those will provide you with tuition support, health insurance, and they may also have additional funds for research-related costs like travel to conferences. And we also have a variety of additional funds available to all students in the programs to help support conference travel. I mentioned a bunch that were all about research. So We want to make sure that our students have every opportunity to present their work and get recognition and to network with other researchers in the field. So going to academic conferences and sharing your work is a big priority for us, and we want to help make it happen. So other sources of funds include, I mentioned before, assistantships like teaching assistantships and research assistantships. We have other student assistantships. And on top of this, we have awards and scholarships for a variety of factors: academic merit, financial need, the ability to add to certain diversity factors. It's really important for us to diversify the public health workforce and for our students to reflect the communities that we serve in our research. So we're really committed to attracting and enrolling and retaining a diverse student body, and we have the funds to support that. And I did mention this earlier in the presentation, but our primary sources of funding are typically limited to US citizens and permanent residents. And regrettably, we cannot guarantee financial support for international students. The international students who have come through our program are typically funded on assistantships. If you're an international student and you want to hear more about this, feel free to email me and we can talk a little bit more about it, and I can share any resources if you're having a hard time finding them on the website. So we've wrapped up the admissions for the fall 2023 entry, and we're looking ahead at fall 2024. So we do have a good amount of breathing room between now and the start of the application cycle. But there's still plenty that you could be doing right now: reviewing the application instructions page, trying to gather your materials, tapping some of your recommendations, starting those written statements. There's a lot you can do before it starts, but what we're looking at here is September 1 is when the application opens. December 15th is the deadline to apply. And then we convey our admissions decisions to applicants by mid-February. And then by April 15th, that's the applicant decision deadline. So if you've received an offer, that's when we ask you to let us know if you plan on joining us in the fall. And then late September is when classes begin. Okay, so in terms of minimum admission requirements, so the UW grad school does require that graduate applicants have at least a bachelor's degree from an accredited college or university in the US, or its equivalent from an international institution. And then they also require a minimum of a 3.0 GPA on a 4-point scale for the last 60 graded semester credits or the last 90 graded quarter credits. And then we also want to see a passion and aptitude for research in public health and health services. So now we're looking at, this is beyond the minimum criteria. These are not minimum cutoffs, but successful applicants usually show a variety of other qualifications. And I do want to emphasize that we have a holistic approach to admissions review, which is a trendy term, but it's a commitment that we take very seriously. It's an essential part of our commitment to equity, diversity, and inclusion. So each year we train our faculty reviewers on how to do a holistic admissions review. We use a standard rubric to ensure that all of our applicants are assessed equitably, and this informs every step of our admissions review process. So I'm going to share some benchmarks. But I want you to understand that none of these individual factors would separately make or break your application. We take a full view weighing all of these considerations. So with that said, we do look to see high academic standing. It's because our program is rigorous. So we want to make sure that our students can thrive in the program. And we have some GPA metrics here, but again, these are not minimum cutoffs. These are just what we often see from folks that receive offers for your reference. And we need to see a natural progression of the student's education, prior experiences, and training relevant to the program. Typically, folks have some relevant academic background, whether it be at a bachelor's, master's, or professional degree level. in a field related to health services and public health, such as epidemiology, health services, biostatistics, health economics, or other social behavioral sciences. Also strong research and publications. It's not required that you've published, but we do love to see it if you have. I mentioned, again, research excellence is what we're all about. So we love to see evidence of applicants' passion and aptitude for research, but again, not a minimum cutoff requirement. And then we also look for strong service orientation, very central to our mission and goals. And we really do value students coming from unique, diverse backgrounds and experiences, and the lived experiences that people bring into the classroom and into their work in public health. And faculty interviews when possible. Like I said, we encourage prospective applicants to reach out to the faculty and get to know them and have a conversation before applying to the program. And you can start reaching out to faculty now. All right, so in terms of the required application materials, we have a much more detailed admissions page, which is linked here. But this is kind of like a quick checklist. So you'll apply online. It's currently the UW grad school online application, and it's actually the portal is going to, by September 1st, it's going to switch to Slate. But our admissions page will have the updated link by September 1st, much earlier than that, but apologies that it still says UW grad school online application, because that is switching to Slate. Nothing else should really change, but that except for where you do it. And then there's an $85 fee to apply, or you can request a fee waiver through the UW grad school. If you do this, you need to make sure that you do this at least a week before the deadline, before December 15th. Because an actual human will review your request, and then they'll go in and pay the fee for you. And we can't refund the application fee, even if you do qualify. So make sure you check out the grad school's fee waiver policy before you pay anything. And if you do qualify, submit that request at least a week ahead of time to give human time to respond to it during probably a busy time of the year. And then, so next you'll provide unofficial transcripts from every college or university where you've earned a degree or taken relevant coursework. So this will be a PDF upload. You might have a PDF, you might have a hard copy. If you have a hard copy, you'll just scan that and upload it as a PDF. We don't request an official transcript until you're offered admission, and then you would have your prior institution send their transcripts to our institution. But basically, if you have the transcript, that makes it an unofficial transcript, like if it's coming from your computer or your person. And then you'll also provide 3 letters of recommendation. So these very commonly come from academic sources like a professor, a mentor, or research PI. And they can also come from other sources like a current or recent supervisor. And then you'll also provide an updated copy of your resume or CV. And then if English is not your first language, the UW does have an English language proficiency requirement. So make sure that you check over that policy to decipher exactly if you have, some folks maybe have different situations where they might not have to submit scores, if maybe has to do with where they did their undergrad, like if they did their undergrad in an English speaking institution. But even if people reach out to me and ask me if they need to submit scores, I always send them the policy and make sure that they read the full policy, because I don't want to give you bad advice. You know your situation better than anybody else. So make sure you look over that policy if this is you. And then we also have our written statements. So we have the statement of purpose and the personal statement. So in terms of these are the written prompts, and they're listed in more detail on the website. But the statement of purpose is your statement of why you're coming back to school at this time for your doctoral degree, why our program, why the PhD in health services, why is this the right place for you to get the training that's going to take you to the next step in your academic and professional career. And here you should mention, as I said, the areas of emphasis that you feel most intent upon pursuing. You should also mention by name the faculty folks that you're interested in working with or having mentorship from. Also, what research centers maybe in our department that you feel drawn to or excited about. And then you'll also provide your personal statement. So I mentioned before that UW has a commitment to equity, diversity, and inclusion, and that's foundational to our program. And we really feel that our discipline of health services research and public health more broadly are built on the values of social justice and health equity. So we really want to see that our students understand this and that they're committed to helping promote health equity for all people and to eliminating health disparities and inequities and inequality that's in the healthcare system. So we want to understand your connection to these values, and the personal statement is an important place to help us see that. And then, yeah, happy news. So we do not require the GRE score anymore. We started waiving them in 2021 due to the pandemic, and then we just didn't bring them back. We found that they were sort of an unnecessary barrier to applicants, and the test was problematic in many ways. So it's not a requirement. All that being said, if you've taken the GRE and you did well on it and you want the committee to see that, you are welcome to submit your scores on a totally optional basis. They'll be considered, but there's no penalty. It's not looked down upon if you do not submit your scores. And yeah, we don't anticipate that the vast majority of students will submit scores. But, you know, we do want to leave that option open for some folks. They might feel like it's a better way for them to showcase their academic ability. All right, so at this point, I'm going to wrap it up and pull it together, and then we'll move into the Q&A. So why pursue your doctoral studies with us? Why the University of Washington PhD program in health services? So we're training the next generation of health services researchers. We've been doing it for more than 20 years. I think we have a great model here. We're committed to giving our students very personal attention, our excellent mentoring, and our flexible courses of study. We have a rigorous, comprehensive, and interdisciplinary curriculum that combines disparate elements of health services. So everything from health systems and policy all the way to the social determinants of health. We have very strong, productive, and long-lasting relationships with our local research centers and medical institutions. We're committed to providing our students with financial support in the form of traineeships and research assistantships, as well as teaching assistantships. We have an exceptional record of student publication, and the average time to degree is very manageable at 4.4 years. We have an excellent record of alumni placement, and our alumni are doing great things out there in the world. And we're part of the top-ranked UW School of Public Health. I know that we were 9th in the nation, according to US News and World Report in 2022. And I believe, don't quote me on that, that number moved up to 6th in the nation this year. And then, yeah, we're in Seattle, which is gorgeous. If you are from this area, you already know. But if you have not come here to visit, I highly recommend that you check it out. I moved here in 2020 from Boston. I'm originally from Ohio, but I've lived some places in the US, and I don't want to leave the Pacific Northwest. If you have questions about ferns and moss, I'm also happy to talk about that and just geek out over all of the plants here and how cool Seattle is. But yeah, here in the left, we're looking at, this is actually a picture from campus. This is Rainier Vista, where we can see Mount Rainier from our campus. Top right, we have an image of the Puget Sound with the Olympic Mountains in the background and our famous ferries. And then we have another picture of campus with the gorgeous cherry blossoms and stuff. So yeah, so another exciting reason to live here. Okay, so with that, I will segue into Q&A time. If anyone has to drop off before that, though, I want to make sure that you see this email here, hservask@uw.edu. You can email this anytime with follow-up questions if you have maybe something really specific that you want to ask about, or you're having a hard time navigating the website and finding resources. You can also book prospective student advising, which is like a one-on-one appointment if you have more questions about your specific situation or about the program. And that will also be in the signature when I send the slides out later. So yeah, if anybody has any questions, feel free to put them in the chat box or to temporarily unmute, whichever you prefer. Anybody? No pressure if you don't have questions, but all right, well, I don't see anything coming in, but again, please feel free to reach out to me. I guess we can, if there are no questions, we can wrap it up a little early. But yeah, hopefully you found this to be informative. Hopefully it helped make your decision of whether this is the right program for you, but continue to stay in touch. And yeah, check out our socials. We do share stories about what our faculty and our students are doing and what events we attend, what conferences we go to, and grad fairs we show up at. So please feel free to interact with us in person. You know, we're always excited to meet folks that are thinking about joining us. But yeah, I'll just say thank you for joining me today and for your interest in the program. And I hope everyone enjoys the rest of their day. All right, bye.